As I went around the country, one of the things that I heard most was the problems associated with pre-existing conditions. Because honestly, a lot of people who are uninsured are not attending a lot of the events, certainly not the events where somebody's spouse is answering questions. And so I talked to more people who actually had insurance but were finding that their problems were associated with this not being covered under their policy. And so the coverage of pre-existing conditions is enormously important in real life to people. Part of the problem is politicians speak. We don't try necessarily to make ourselves entirely clear. On some things, we really actually try to be obscure. Ask politicians about Medicare, and you'll get such muddied answers because nobody really has an answer. So instead, what they do is give you some platitude and some assurances and language about perhaps their other healthcare policy that maybe you get the impression apply to Medicare, but nobody really has answers, so nobody talks about it, or they talk about it in a way that's unclear, and the American public is not informed until you tell them, because frankly my telling them doesn't help. You're telling them that nobody is just addressing this issue in a meaningful way. In the 2004 campaign, I bet if you asked people who were in the campaigns, the Bush campaigns and the Kerry campaigns, what are the differences in the healthcare policies of these two men? They could not tell you. I spent several months on the campaign critiquing the healthcare plans of the other Democrats. I know none of you were actually there, but don't feel too bad. The press didn't actually cover me that much. But I spent very little time talking about Republican plans. And now we actually have a Republican that we know is going to be the nominee. So today I want to talk a little bit about Senator McCain's plan.